My name is Ryan Grimm. I work in the education division and I'm an education researcher and I research students with disabilities. My primary project that I'm co-leading is called Innovative Technology for Early Childhood Assessment. During the pandemic, a lot of young children between ages 0 and 5, did not get the services that they needed for their disabilities because assessments were unable to be done as well as they were prior to the pandemic, because assessments on early childhood are usually done in person, either in a clinical setting or perhaps a preschool setting. So we know that remote assessment is going to continue across the country. Some states may not have official stances on it, but we know that a lot of local programs are continuing to use remote assessment because they've found some benefit from it. It's especially efficient for rural families and practitioners in rural areas, because instead of driving an hour and a half to 2 hours to see a family, they can do remote assessment over a laptop than a phone. They can actually assess more children in a day than they would be able to if they had to do everything in person. And this might be particularly important for if a child in the home is immunocompromised or another family member in the home is immunocompromised or maybe sick, and they can't have as much exposure to the outside world. So remote assessment becomes a really important tool when that happens. We are disseminating free and publicly available resources for state administrators, local administrators, and practitioners, both in early childhood programs, which come before preschool, or the same folks at the preschool level. These resources will help them ensure that there will be hopefully a smooth transition of services from early childhood to preschool, or if they are identified in preschool as needing services, then hopefully those assessments will be done properly if they are done remotely.